that and study that. So
yeah, I get that. Yeah.
All right.
Yeah. I'm gonna put it in the chat, the book, just in case. Not that you have any extra time.
Yeah. All right, ladies. I thank you all for being here. Let's go through this test and see. All right. All right. Okay. Ms. Parker, I see you've joined us. Sign in, please, so I can know who all was here for the review. And I see Ms. Tack.
Okay.
Is that Ms. Tackno? Who's that? Is
Yes,
that Tack?
ma'am.
Oh, okay. All right. I know you're at
I
work.
might have to. Oh, I'm sorry. I might have to leave early. I'm driving right now.
Okay. Who's that, Ms.
appointment.
Parker?
yeah.
Who's
Yes,
that?
ma'am.
Okay. All right. Let's go over it. So I'm gonna pull it up so you all can see it. Okay. Let me share my screen. Let me see. Do I have it? Wait. I got 1,000 things. Okay, exam 1. Okay. Okay. All right. So exam 1. Okay. Here we are. Can y'all see it? Can you see it?
Not yet.
Okay.
I don't see it.
Okay. Not yet?
I
You can't see?
that I'm pulling. It may be me.
Oh.
It's me.
Okay. Oh, no. Okay. You got it, Miss Madison?
Yes, ma'am.
Okay. So here we are. So the nurse performing a health assessment for an assigned client. Which of the following would be the most accurate description of the nurse's role? And the given answer was utilizing the nursing process to systematically collect and analyze data about a client. Was that clear?
Yeah, I put that.
Anybody had a problem with that one?
Had anybody put anything different?
Different. Yeah, that's what I'm asking. Okay.
I'm not sure. Do you guys have access? I know that. I'm pretty sure I put that.
Because that's the definition.
Yeah.
That's the definition of nursing process.
Right.
Yeah, I
Yes.
remember you saying that in class. I'm like, okay, that's the one.
Yeah.
Okay.
Yeah.
Good. Okay. All right. We see the rationale is utilizing that process to systematically collect and analyze data about a client is the most accurate description of your role when performing a health assessment. So that's the answer for that one. All right. Oh, now I get it.
And that's just the ad pie info.
Yeah. Let's see. All right. Okay. Number 2, you're performing a focused assessment. You know, they've had the different types of assessment. The nurse should use this type of assessment for which of the following clients?
The abdominal pain.
2 days ago. So the client was admitted with abdominal pain 2 days ago would require a focus. Was that, I thought that one was pretty straightforward. Anybody had any
Yes.
difficulty with that one?
Yeah, I think I got this one wrong.
I had the total hip replacement.
Oh, wait. I think I put
Did you? That was 2 weeks.
I think I put the total hip replacement.
You did? But that was 2 weeks as opposed to 2 days.
Oh, I think I put the client who came into the urgent care clinic reporting difficulty breathing.
Breathing. So let's see what their rationale.
I think there was some example that I don't know. I just remembered it and I was like, oh, maybe it's that one. I don't know.
Yeah,
Okay.
realize that
Well,
actually use the abdominal one as their example
Oh, okay.
and realize it.
Okay, so that was in realize.
Yes.
Okay, so the client is stable and abdomen is the highest priority issue for this client. Focus assessment can occur in any setting and typically involves 1 or 2 body systems. You perform an in-depth assessment on a specific body area or health issue. Okay. Client is at the local clinic requires a physical for a new job. The client who is scheduled to have a total hip replacement in 2 weeks would need a comprehensive health assessment. Okay, so, all right. So that's 1. So number 2 is going. All right, number 3. You are teaching a group of clients about primary health prevention, primary, secondary, tertiary. Which of the following information should you include? Primary.
Immunization.
We went over this. Was that
Yeah.
a problem?
No.
Primary. No, that wasn't a problem for you? Primary.
Is everybody questions different?
Well, you have them. They're out of sequence. They're randomly assigned questions. But everybody should have had this question. You didn't have this question, Ms. Alexander? Huh?
No, ma'am.
No, you didn't have it.
No.
Oh, wow. Anybody else didn't have this question? Everybody else had it.
Mm-hmm.
Okay. And what did you pick?
Immunization.
We talked about that, right? Okay. All right. Well, I don't know why you didn't have it. So let me put number 3. Alexander. Okay. All right. Let's move. You're teaching a group of clients about tertiary health prevention. Which of the following should you include? Tertiary. Tertiary does what?
That's where you deal with something that's already been
I
diagnosed.
said to prevent any further. Who already has an illness or disease. You focus on preventing complications. So,
Okay.
instructions for crutch walking for a client who had a leg cast applied.
Yeah, that's the
What
one.
else? Did y'all put that, or what did you put?
I put that
I
one.
put that.
Okay. Ms. Madison, you got that one?
Yes, ma'am.
Okay.
So far, these I've gotten.
That's what I'm saying.
Where are the bad ones?
Yeah, let's get to the meat of the matter, huh?
Right.
Yeah. Oh, goodness. Okay.
Okay.
Trying to go too
So-
fast. So we're on number 5. Okay, you performed a head to toe for a client who was admitted with chest pain and found the client has high blood pressure, headache, and irregular heartbeat. Now, right there, you should use which of the following models to document and communicate the
Body
findings.
The
system.
body
Had to be.
systems.
Yeah, I put that one.
Had to be body systems because you
It's
got a
talking
bunch
about
of-
different. Yeah.
Yes. Yeah, okay. See, so we got these. So what was the issue, huh?
I know.
We're gonna get to it.
Let's see. Let's see.
It's coming.
It's coming. It's gonna keep going, huh? Okay. You're planning an education conference about communication process. Which of the following information should you include?
I had problems with this one. I already know.
Did
I
you?
put D, but
Self-awareness must be identified. So probably you know that the question was information. Wait, you're planning this. It's a conference about the communication process. So the process involves a sender and a receiver, right? That's information you're doing a conference on it. You're educating on it. And so the communication process involves sending and receiving. The question was, which of the following information should you include? That should be the first thing you include. That communication involves a sender and a receiver. All right. So we had problems with that one.
Yes.
Okay.
I got
did.
Yeah,
What
I
was
did
your
too.
issue? What was your issue?
Well, I got this one, but
Okay.
I had a lot of trouble with, okay, I know before,
determining it.
right, before the client, I guess, is going to successfully or be willing to receive those messages. I know that was mentioned and realize that, that a nurse-client relationship has to be built. So I was like, okay, well, do they want us to put that in order? Kind of how that would happen, or are we just looking at the process?
So if they're saying you're giving a conference about the communication process, if you had a nurse-client relationship, that's what kind of process? A sender receiver, right?
Mm-hmm.
So the process was that sending and receiving. So I can see how that could be confusing. Okay.
Yeah,
you
you
got that
can't-
one?
You
Go ahead.
can't think into it. You have
No.
to. You read the
That's the
question and
problem.
immediately
Take
look
it at
at it.
face value. I
Take
told
it
you,
at
don't
face value.
second guess.
I
Right.
analyze everything. So.
I did too.
Right.
No, you
Don't
can't
second
analyze.
guess. Don't second guess and don't change an answer.
And
Never
in
change.
fact, what I would do is I would read the question and then I look at the first answer and say true or false.
Mm-hmm.
Move on to
Each
the second one.
True
And then
or
I'd only go through them once.
Mm-hmm.
and then I'd pick my answer because you don't realize all the studying you're doing. It's in there. It's in your sub brain,
No.
and it's gonna pop up
Yeah.
anytime. I mean, that's like if you work on a med surg unit and somebody has a visceral eruption, and you're gonna know, oh man, I need to do this, this, and this because you're on a med surg unit. So I mean, all that information is there. You just can't think too long about it because then you start thinking about what if, and that's going to throw you off.
And that's why I say don't change a question, because if you have studied at all, don't change an answer, because if you have studied at all, generally that first answer, it will pop into your head first. So if that's what came to your mind, you need to put it and don't change it. Don't second guess yourself.
Yeah.
That's a very good point, Dr. Clark. Thank you. Okay. All right. So you're evaluating the effectiveness of using the communication process to talk with a newly admitted client. Which of the following, these are the ones that generally get people, would best indicate that the communication was successful? Now, this is where what you were talking about is right here, Miss Madison, that this relationship was established.
Yeah.
Successful communication. You got that one right?
Yes, ma'am.
Okay. Yeah, that's what you would think about for the other.
Maybe so.
I think so. Okay. All right. What about other people? Did y'all have a problem with this one? Communication.
I got this one wrong.
Who's that, Kelly?
Yeah.
Okay. Communication. So we had some problems with communication process. Okay. All right. What do you think it was, Kelly?
I believe I put the nurse was able to collect subjective data from the client. I think I put that one on.
You think you put that one?
That's
why
what I think.
Yeah, that's what I put.
Right. Yeah, that would be like Dr. Clark said earlier. All of them are probably right, but the best indicator is that it's a trusting relationship, that nurse-client relationship. Okay. All right. Okay, you're talking with a client who has several previous hospitalizations, and we talked about this one in class. Which of the following components of the communication process should you identify as a priority with that client?
Perception.
Said several, been in the hospital several times. So which one?
The perception, because
Yeah, I put perception.
We discussed something like that in class, did we not?
I believe so. Yeah.
Yeah,
we did.
Okay. Anybody had problems with that one? Alexander, where are you? Taylor?
Oh, God. Hey.
So far, you were great.
Yeah, so far it's been okay.
Yeah, same here.
Right.
It looks like
This is the test. This is the test y'all took, right?
Yes, ma'am.
All right. Okay.
So far, I look like I would have 8. I don't know what the heck.
Yeah. So we're gonna move on.
We got
So you're
49.
practicing therapeutic communication with a client who states, I do not believe I have cancer. Nobody in my family has ever had cancer. Should I get a second opinion? Which of the final responses would demonstrate reflection?
I missed this one.
Oh, I put.
Reflection.
Tell me what you mean by you do not believe.
Okay. That's restatement.
I put you want to
Reflection.
get a second opinion, which is restatement too, I think.
Yeah.
Oh yeah.
Yeah, see, remember restatement, reflection, yeah. Okay. Sounds like communication process might have given some problems. Yeah, sounds like it. Okay. All right. What you say, Taylor? I haven't forgotten you. Miss Nguyen,
I said D.
you said D?
Green, but you did not, yeah.
Okay, all right. Okay. And Miss Nguyen, what about you?
Yeah, I put that one.
You put D as well? So, okay. Okay. Let me put.
Did you think that you would ask them to elaborate why?
Didn't I tell you what I told you about why?
No, why?
Not why, but like, not that way.
Don't ask why. You don't ask why.
You sound like you're in disbelief.
Okay.
of the
Okay, so let me look at this. So you're practicing therapy for me. I do not believe I have cancer. Okay. So do you think the tests were inaccurate? Okay. You sound like you are in disbelief of the test. That's a reflection. That is a reflection, y'all. Okay. All right. We need to look at communication. You're talking with the client about the client's feelings of anger and stress over the divorce. You sit down next to the client and state, I am listening. Go on. Which of the following types of therapeutic communication were you demonstrating?
I put active listening.
Yeah, but active listening.
I put elaboration. I didn't get this one.
Well, the elaboration was the correct answer.
Oh yeah. Okay.
Now, I would have said active listening, but no, because you're encouraging them to
Yeah,
continue.
to keep talking. So
Continue. So that's correct. Do we see why that was correct?
I do.
Okay. All right. Okay. Yeah, that's like tell me more.
Mm-hmm.
Tell me more. Okay, so I'm gonna put here the communication process gave some issues. I think is that you studied so much about the assessment piece, communication.
we just thought like, oh, you know,
Yeah,
it's
I
simple
know
to
this. Yeah,
communicate,
I got
but-
this.
Right.
I think that might have been the problem there. So you're talking with a client's spouse who states, I'm so worried. What if my spouse never gets any better? Which of the following would be an appropriate response by you, the nurse?
Are you concerned?
Yeah, I
You will
put
not
that.
know.
Now, are you concerned?
I had put B.
You put B, I'm so sorry. You're sympathetic. We're going to use empathy, not sympathy. Remember? Remember that? Okay. All right. Okay. All right. You overhear a new nurse talking with the client and utilizing false assurance. The nurse, you should discuss which of the following that would best assist the new nurse with improving therapeutic communication skills. What?
Empathy.
What you say? Well, who else said that?
I'm almost positive that I put empathy, but I know it's self-concept. I knew it. I went.
Now, since you're reading it, huh?
Yeah, I went
Yeah.
back and forth and back and forth.
Y'all got that? It was between those two. Taylor, you two? You two, what did you put?
I put empathy too.
Yeah.
Yeah. Okay, so a nurse talking with a client. False assurance, false reassurance. You know what? I will question that one. I probably would have put empathy too. What about you, Dr. Clark? Is she still with us?
Yeah,
Dr.
I'm
Clark?
here.
Oh,
Yeah,
okay.
I'm fixing to jump off because I have another meeting, but
I understand.
I'm going through. I'm trying to find the questions on the exam to see how many people got it correct.
Okay.
And it looks like it was like 60% got it correct and 40%. So that may be something. I would have put empathy myself.
Yeah, that's what I'm saying. Yeah, well,
So that
I'm
may
a
be one we need to
I'm a
look at.
question it. I'm a question. I got it
Yeah.
down here.
Yep.
Okay.
Yep.
All right. Well, thank you so much, boss, for coming. And come
Yes.
back if you got time. I'm sure
I
we'll
will.
still be here.
No, I will. Okay.
Okay. Thank you. All right. Okay. You are conducting an interview with a newly admitted client. Which of the following actions by you would demonstrate the beginning phase? Now, these are the phases, right? Okay. Which one would reflect the beginning phase?
I don't even remember what I put on this one. I really
Yeah, I'm
don't.
trying to think too.
Yeah, that's the thing about not doing it right after the
Right.
test. That's the problem.
B. I think I put B.
Yeah. Wait. I put.
Yeah, I think I put B.
What brought you into the hospital? Wouldn't that be what is it? Pre-interaction? There's something before beginning?
That's the pre-interaction phase.
Pre-interaction would be what brought you in. When
Well,
I
I
entered,
thought that pre-interaction was collecting data
Yeah, I was
and
about to say
medical
that.
history and the file and the charts. Not
well,
you
yeah,
have
but
to
okay,
contact the person yet.
that's very true. But when you collect data, what's the first thing you're gonna ask?
Okay, so that's why I got it wrong. Like I thought
So what you
interaction
asking
was
what
your
brought
doing-
them in?
Wait, one at a time. Come on.
I know.
What'd you say? Come on, don't stop.
Okay, so would you ask them what brought them in before you introduce yourself? Because I know in the beginning stage they
That was
said
the first
in
step.
the introduction.
right. I would have thought that would have been the beginning, not pre-interaction. 'Cause
Pre-interaction.
I thought it was you and a computer gathering information, his chart and medical records, collecting
But
data.
that's what it's saying here. So maybe I was
Need
I was
to,
wrong. Look what it
my-
says. It says collecting data from the client's medical record was pre-interaction. The beginning phase was introducing, so you're right, self and explaining the need to ask personal questions. The working phase, asking closed or open-ended questions like, do you take medicines or what brought you into the hospital?
Right.
Okay.
So, yeah.
And the last phase is the closing phase where you summarize the most important. So here it is. So which of the following actions by the nurse would demonstrate the beginning phase? And that would be explain
You
the
explain
new
the need.
and the need to ask questions about the clients. Okay, so do we have introduction of self on it? What brought you? No. Okay. All right. Communication, I could see, gave us a problem.
Yeah.
Okay, right there. All right, because right there, I see some people might have lost 8 points right off the bat with communication. Okay, all right. We'll move on.
Okay, so what was the answer of 13?
Oh, the
And
answer
the-
for 13 was
A.
explain. No, the
No.
answer for 13 was this bottom one, D here.
You
The
explain
nurse
the
explains
need.
the need to ask questions about the client's medical history.
Because in the beginning phase, you have to tell them why you're doing what you're doing. So that
What
is
you're
that.
doing.
Yeah,
Introduce yourself first, then you say what you're
what
doing.
you're doing.
Right, right. Y'all here? Y'all with me?
I get it now.
All right,
After
I know.
after-
Now, I heard y'all talking. I didn't want to interrupt, but I will say this was your first test with assessment. I know y'all wiped out because I'm wiped out myself, ladies. I'm very upset. But it was your first test with assessment. We're gonna walk through it. If there's, I'm gonna try to find a different way to kind of get you the information, but we're gonna just let's see. I know you're upset. So you're collecting data for health history for a newly admitted client using secondary sources. Which of the following sources would you be collecting the data from? Select all that apply. If it is not the client,
Is secondary.
so what?
Said all except
Can
the
you
client.
roll down? Yeah. I know
Yeah,
I missed
that's
it.
it. That's all of them. All right, very good. Y'all had that, right? Good. That was a given. Okay. So you're documenting the components of the health history that you collected during the working phase of the interview process. Which of the following should you be documenting? Remember, that was where that question came in. What brought you here? Right? In the working phase, remember?
Yeah, I
know
missed
y'all-
this one.
Y'all tired. So what
Yeah.
you put? What you put?
I put in the working phase is when you're getting the objective data from the
Yeah, I put
physical
that
exam.
too.
Oh, wait now. Okay, let me go back up here. Objective data. Okay, working phase, asking closed or open-ended. What brought you here? But that's still subjective and objective. Okay, I'm gonna argue that one, y'all. Okay, hold on. Let me go back down. What was that number? That was number 15.
15.
15. I'm gonna argue that. Objective. Objective data. Objective data is your assessment. Remember?
Yeah.
So that would have been subjective data.
Mhm.
So this answer is correct. Y'all understand why?
Care.
Objective data is your vital signs, your hands-on assessments. Right? That's not in they're asking for the working phase, right?
Mm-hmm.
What are you saying, ladies?
I
Right,
see it.
wrong?
Mm-hmm.
Okay.
Yes.
Hey,
Reason you're seeking care, why are you here?
So yeah, that was the reason for
What brought you
seeking care.
today?
That was it. Yeah, okay. All right. Oh boy. Okay. You're collecting data from a client for a health history and want to ask the client about an obvious bruise on the upper arm. Which of the following would be an appropriate action by you during the interview process? The interview process.
I put
Wait
K.
till the end.
Okay.
Yeah.
Wait until the end. So y'all got that one.
Yeah.
See, that's what I'm saying. Y'all got the assessment piece, I believe. Communication was problematic because, like you say, Kelly, you probably figured I already know that. I can pay less attention to that. So you're performing a physical exam for a client. Which of the following actions